Depression is one of the most common mental illnesses in our country. It affects more than 20 million people each year.
Yeah, that's right. It can be very hard for some people to treat it, but now there's a new nasal spray that could be used as an alternative. Our 9 health expert, Dr. Payal Kohli, is joining us now to talk a little bit more about this. Dr. Kohli, good morning.
Good morning, guys.
What is different about this nasal spray from other drugs we see to treat depression?
A very, very interesting, a very different type of drug. So most of the drugs that we have for depression really target a chemical called serotonin in our brain, selective serotonin reuptake inhibitors. This targets NMDA, which is involved in our mood and our regulation, so it's a different receptor. The onset of action of this particular medication is usually within hours. So sometimes it can take weeks for the other type of drugs to kick in, but this you can get relief within about 24 hours. And it's a nasal spray, which means it gets into your system really very quickly and binds to a receptor that also binds something called ketamine. And if you guys remember back in the 80s and 90s, Special K was a drug of abuse because it creates a euphoria. So that's really the controversy about this particular drug, is that could it have the potential for abuse because it works so quickly, it creates euphoria. There's a phenomenon called psychological dependence where you need more and more of it to get the same type of effect. But really it can change the whole landscape for someone who's had treatment-resistant depression where they're failing everything else.
Yeah, because when I read about this, and I talked to Dr. Kohli about this in full disclosure, as someone that suffers from clinical depression, I thought this is groundbreaking. And I know you feel that way too, but talk to us about the controversy. Why are you concerned that it may be abused?
I have a few different concerns. So there's a black box warning on this because, again, it's addictive. It's not quite as addictive as ketamine, but still is addictive. And in the people that we're using it in, these patients who are depressed, they generally tend to have chemical imbalances that sets them up for addiction. And if they've been struggling for a long time and they feel better on it, you can see that phenomenon of psychological dependence. Right. So that's one of the reasons it's actually administered in a healthcare setting, because of that potential for abuse. Because if you just give somebody the spray at home, you can imagine they would keep taking it. The second thing is we don't know long-term safety and efficacy. Right? In the short term, yes, within 24 hours you feel better, but in the long term, years later, what exactly is it doing to your brain? What exactly is it doing to your body? In fact, some concerns in patients who've abused ketamine have been raised about bladder issues and such in terms of long-term safety.
Right.
So that's another question mark in my mind. If we're starting to use it, and it's already become a blockbuster drug, it's one of the most popular drugs out there because it's so effective.
When you say it's out there, of course, you're talking about safety and addictiveness. How accessible is this drug to a lot of people?
Well, and this is my other concern about this drug. It's over $1,000 per treatment.
Wow.
Because you're talking not just about the cost of the drug, which is expensive, but also the cost of monitoring, because it can raise your blood pressure and it can create cardiovascular complications. It can change your psychological state. So you have to be watched for 2 hours after you get it. So all of those healthcare costs associated with it really does create a dichotomous have and have-nots. And we already know that disparities when it comes to mental health and people of color and underserved populations are really bad. And so if this is only a drug that can be accessed by people who can pay that hefty price tag, that's, again, creating a problem, in my mind, in the medical community. So I think it really raises the question of what do we need to do better as physicians and as a healthcare system in terms of how do we, not open up Pandora's box with this drug, because it does have infinite potential, but it could have a lot of risk as well.
Well, and I'm with Sam, as somebody who's also suffered from depression. I mean, the second you find something that works, you don't want to let it go. So I fully understand the concern.
It could be life-saving for people.
Right.
Well, you talk to patients who've received this particular medication, and they say the veil has been lifted. Like they've been struggling, they've been thinking about taking their life for years, and all of a sudden they can see the light. So it really can change lives, I think.
Wow, groundbreaking. Thank you.
All right, Dr. Kohli, thank you. And again, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Let's get a check of your forecast now with Keely.